A tiny rash, a little redness, a bit of itching. Most parents ignore it. But what if that small skin problem isn't as harmless as it looks? And what if waiting is the reason it keeps getting worse? Today, we're exposing the pediatric skin conditions that millions of parents underestimate. Let's challenge a dangerous assumption. It is just a rash. Really, because that is exactly what countless parents say before they discover something more serious. Here is the uncomfortable reality. Children's skin is different from adult skin. More sensitive, more reactive, more vulnerable. Yet many families treat skin symptoms like temporary inconveniences. A little redness. Ignore it. A little itching. Ignore it. A little dryness. Ignore it. Until suddenly, it is not little anymore. Nobody talks about this enough. The skin is often one of the first places the body signals that something isn't right. Meet Liam. He is 6 years old, energetic. Happy, always playing outside. One day, his parents notice a few dry patches on his arms. Nothing alarming. Just dry skin. Or so they think. A few weeks later, Liam starts scratching more often. His sleep becomes disrupted. He is irritable. His teachers notice he is having trouble concentrating. The rash spreads. His parents try random creams they find online. Some help briefly. Others make things worse. Months pass. The itching becomes relentless. Family stress increases. Doctor visits finally reveal the truth. Liam isn't dealing with simple dry skin. He is experiencing eczema, a chronic inflammatory skin condition affecting millions of children. The diagnosis changes everything. Not because it magically cures the problem, but because now the family understands what they're facing. And they finally have a plan. Here is what makes pediatric dermatology so important. Many skin conditions don't stay on the skin, they affect sleep, mood, confidence, school performance, family stress, quality of life. A child with persistent itching may struggle to focus. A child with visible skin conditions may experience embarrassment. Some children withdraw socially. Others become frustrated. And many parents underestimate how deeply skin health can affect emotional health. Here is the truth. When adults think about serious health concerns, they rarely think about skin. But pediatric dermatologists know something different. Skin problems can have a massive impact on childhood development. Not because they're always dangerous, because they're often persistent. And persistence changes everything. Why are childhood skin conditions so common? Because children's skin is still developing. Their skin barrier isn't identical to an adult's. Environmental triggers matter. Genetics matter. Allergens matter. Irritants matter. Even weather can matter. And here is where parents get confused. Many skin conditions look similar. Redness can mean different things. Itching can mean different things. Rashes can have many causes. That is why self-diagnosis often leads families in circles. Let me be blunt. Google cannot examine your child's skin. Social media cannot diagnose a rash. And random internet advice can delay proper treatment. Professional evaluation matters. Because the right diagnosis determines the right strategy. Quick question. Would you ignore a persistent cough for months? Probably not. Then why do so many people ignore persistent skin symptoms? The answer is simple. Skin conditions often look harmless, but appearance can be misleading, and that is exactly why pediatric dermatology exists. So what does a pediatric dermatologist actually do? Far more than most people realize, these specialists focus on diagnosing and managing skin, hair, and nail conditions in infants, children, and adolescents. They evaluate patterns, symptoms, triggers, family history, and treatment responses. Conditions commonly managed include eczema, acne, birthmarks, psoriasis, warts, infections, and many other skin disorders. But here is the key. Treatment isn't just about medication, it is about education. Families learn how to identify triggers, how to protect the skin barrier, how to manage flare-ups, how to support long-term skin health. And that is where outcomes improve. Many parents spend months guessing, trying random products, switching routines every week, hoping something works. But guessing is not a strategy. Assessment is knowledge as consistency is. And when families understand what is actually happening, everything changes. The goal isn't perfection. The goal is control. The goal is reducing symptoms, improving comfort, improving sleep, improving confidence, improving quality of life. Those improvements can be life-changing. But there is one mistake parents make that pediatric dermatologists see over and over again. And it often makes skin problems worse. The mistake treating every rash the same: one cream, one solution, one assumption. That approach can backfire. Because different skin conditions require different approaches. What helps one condition may irritate another. What works for one child may not work for another. Here is the reality. Children aren't small adults. And pediatric skin conditions don't always behave like adult skin conditions. That is why individualized care matters. Not internet trends. Not viral videos. Not miracle products, evidence, evaluation, guidance. Those things matter, and sometimes the best thing a parent can do is stop experimenting and seek professional advice. Now for the encouraging part. Most pediatric skin conditions can be managed. Many improve significantly with proper care. Some eventually become much less severe over time. Awareness changes outcomes. Early evaluation changes outcomes. Consistency changes outcomes. The goal isn't fear. It is empowerment. Because once families understand what is happening, they can take meaningful action. Think about how powerful that is. Less itching. Better sleep. More confidence. Less frustration. Better quality of life. Sometimes the biggest breakthrough isn't finding a miracle cure. It is finally understanding the problem, and understanding creates progress. If this video helped you better understand pediatric skin health, subscribe now. We create evidence-based health content designed to help families make informed decisions. Leave a comment below. Has your child ever struggled with eczema, rashes, or another skin condition? What helped the most? We'd love to hear your experience. And if there is another pediatric health topic you'd like us to cover, let us know in the comments. Medical disclaimer: this video is for educational purposes only, and should not be considered medical advice. Always consult qualified healthcare professionals regarding diagnosis, treatment, and individual medical concerns. Thank you for watching. And remember, sometimes the condition affecting a child's happiness isn't hidden deep inside the body. Sometimes it is visible on the surface. The question is whether we choose to pay attention.